Hello and welcome to the P2 Network POCUS series. My name is Margaret Lin-Martore, and I am a POCUS faculty at the University of California, San Francisco. And today I'm happy to chat with you about point-of-care ultrasound and length of stay and patient satisfaction. Our goals for this lecture are to describe the data on point-of-care ultrasound and length of stay, as well as the data on point-of-care ultrasound and patient satisfaction. So why does this matter? So you may notice that this lecture is not like the other lectures in this series where we're not talking about a specific indication and then going to the how-tos of that application and indication. Rather, we're taking a step back about kind of how is point-of-care ultrasound, or how could it be beneficial? When we think about the true north goals of an organization, or like the ultimate idea of what we want to do, we want to provide high quality, the best high quality patient care that we can. And so looking at things like patient-centered outcomes, including patient satisfaction, and looking at things like high quality care and efficiency, like length of stay, can help us know how we are providing better care, or if we are. And this is especially important for things like point-of-care ultrasound, where point-of-care ultrasound is a relatively new technology and skill in pediatric emergency medicine. And so when we're kind of rolling it out, when we're training people in this new thing, a relatively new thing, we want to have data and evidence that shows that we are helping to improve care by doing this. So let's start with this scenario. You have a 6-month-old who's presenting to you with posterior thigh redness for a couple of days. Mother states the child's been a little more fussy, but no fevers, still feeding well, overall doing pretty well. Their exam, they have reassuring vital signs. The rest of their exam is very reassuring, but in the area of interest, there is some erythema and induration, though no clear fluctuance. You're working with a team. Someone says, hey, maybe we should do an ultrasound. And you're like, yes, let's do an ultrasound. But not too long ago, the question was, what kind of ultrasound should we do? Should we order an ultrasound from radiology or do a point-of-care ultrasound where people, again, people were still learning this skill? So with a radiology performed ultrasound, as you may know, you typically put in an order in the computer or put in an order somehow, then that gets put in the system, a radiology technician comes and then does the ultrasound. This may require the patient actually leaving the emergency department to be able to get that done. And then the images are interpreted by a radiologist who then lets a clinician taking care of the patient at bedside know the kind of the results, and then a decision can be made by the next steps and plan. Contrast this with point-of-care ultrasound, where the clinician at bedside is the one performing the ultrasound and making the decision about what to do next. And so in where I practiced at the time, we were rolling out ultrasound, and some people were doing it, some people weren't. And we looked at patients who got either point-of-care ultrasound or radiology and compared their length of stay. And what we found was for this soft tissue indication, the point-of-care ultrasound group had a significantly decreased shorter length of stay. 73 minutes shorter, in fact. And if you look specifically at patients that ended up getting discharged, it was almost an hour and a half of time that was saved, and that was shorter. So for your patient, you do an ultrasound. I couldn't resist throwing in at least some ultrasound videos in this lecture. And this is what you see. And you can see this kind of nice hypoechoic, and there's some parts that are anechoic region with maybe a squish sign just there. Again, right here, you can see some purulent material swirling around, and this is an abscess that you can drain. Contrast that with, let's say, a cellulitis. These are kind of examples of cellulitis. Here you have the kind of an earlier cellulitis where we're fanning through affected and non-affected tissue, where here there's normal, nice ecotexture architecture of the tissue. And here you can see it's kind of hazy, it's hyperechoic, edema in the affected tissue here, and that's kind of an early cellulitis. And you can contrast this with the image on the right, which is a later cellulitis where they have that classic cobblestoning, where there's anechoic fluid in between kind of layers of subcutaneous tissue here. But for your patient, you got this ultrasound image, this nice abscess. With your point-of-care ultrasound, you perform an incision and drainage, or IND, and then discharged them home with antibiotics and follow-up, and saved an hour of time, or could have saved an hour of time, and knowing that you kind of provided kind of rapid, high quality care. What about for other POCUS applications? Does POCUS save length of stay or decrease length of stay? So for neck swelling, there's been a study that looks at this, that it looks point of care ultrasound can save over an hour of time. For pelvic ultrasound, for example, looking for an intrauterine pregnancy or free fluid, it can save over an hour of time. For appendicitis, when point of care ultrasound is used as part of that diagnostic workup, it can save more than a half an hour. For intussusception, while using point of care ultrasound, can save multiple hours in this study. And then for bladder fullness, so, sometimes we want to know how full the bladder is. Maybe we're getting a radiology performed ultrasound to look at something and they need a full bladder, or for cath and you want to know if they have a full bladder, it can save more than a half hour of time. So the big take home point is point of care ultrasound is decreased with length of stay and is associated with decrease of length of stay. And that is true for multiple different applications. Okay, what about for patient satisfaction? So let's say you are, and I hope you are, the POCUS enthusiast at your shop, and you're trying to increase the number of scans being performed at your institution. So you want to perform them, you want your colleagues to perform them, the trainees, you want everyone to be performing POCUS, but you've heard people saying, hey, I'm worried that the families won't like it or the patient won't like it. I'm worried it'll decrease satisfaction. I don't want to, make them upset if we're like practicing and we're learning this skill or we're doing this kind of relatively new skill or technology. What's the data for this? Well, looking at adult patients, there is a study that looked at overall satisfaction with patients who received a point of care ultrasound versus those who did not. And actually, they found that POCUS increased satisfaction with the overall ED visit, their opinion of diagnostic testing, as well as their perception of their ED physician. So actually, that's great. So point of care ultrasound seemed to make people more satisfied. What about with kids? So this is a study we looked at where we actually looked at both diagnostic and educational POCUS studies compared to controls who did not get a POCUS. So this means for diagnostic studies, this point of care ultrasound was part of their clinical workup versus educational studies where we would have scanning shifts and trainees and other people were practicing, and we let the families know, hey, we're just practicing this. This probably isn't part of this isn't part of your clinical workup. And we found that for the point of care ultrasound group, they had very high satisfaction. So a 94 out of 100 scale. Our controls who did not get ultrasound also had a high satisfaction, 91 out of 100 scale. So while there was not statistical significance improvement because they just started so high, there was definitely no decrease, and it's associated with high satisfaction. Importantly, when we asked patients and families if they were offered another point of care ultrasound at their next visit, would they want one? They all said yes. So on the flip side of that, so litigation, so a very unsatisfied patient, there has been a study looking at lawsuits related to point of care ultrasound, and there actually have been no lawsuits for the performance of point of care ultrasound or interpretation. The only lawsuit found in this review was actually for a failure to perform POCUS, and this was in the case of a patient who had an ectopic pregnancy. Moving past that, what are some tips to just make sure that our patients are comfortable while we're doing point of care ultrasound? Well, warm gel can always help. So this is an example of a gel warmer in this upper right picture here. Also, if you don't have a gel warmer, some people like to carry the gel in their pocket, the one that they're going to use that shift, because that can just warm it a little bit. But also some techniques that work well for physical exam things also work well for point of care ultrasound. So demonstrating on a parent first what you might be doing, explaining the steps for older children, allowing the patient, giving them some kind of control while you let them like touch the probe and feel the probe so they have a sense of what's going to happen. And then having a parent do a comfort hold while you're doing the ultrasound. It may require some thought about how you best want to position them. Maybe the parent needs to be in the bed and hold them, for example. But those can all be things to make the patient more comfortable as you're doing the ultrasound. So take home point for that is POCUS, both diagnostic and educational, is associated with high patient satisfaction and does not decrease satisfaction. So take home points for this lecture: POCUS is associated with decreased length of stay for patients for multiple different applications, and it's associated with increased and high patient satisfaction. There's data to support that. Here are my references from this lecture. I'll leave that for a little bit. And here is my information. Again, my name is Margaret Lin-Martore. Thank you for listening here today. I would love to hear from you. My email is at the bottom of this slide for any comments or questions. And thank you for your time today.